name is Karina Granda. Congenital syphilis. Forecast. Causes. Congenital syphilis is caused by the bacteria Treponema pallidum, which is transmitted from the mother to the child during fetal development or at birth. Almost half of all children infected with syphilis while in the womb die shortly before or after birth, despite the fact that this disease can be cured with antibiotics if detected early. Forecast. Many babies who were infected early in the pregnancy are stillborn. Treatments of expectant mother decrease the risk of congenital syphilis in the baby. Babies who become infected by going through the birth canal have a better prognosis than babies who were infected early in the pregnancy. Possible complication. Health problems can occur if a baby is not treated include blindness, deafness, deformation of the face, nervous system problems. Nurse application. Oriented usury and his partner in syphilis and risk factors. Give advice of the importance of periodically attending follow-up controls. Indicate the warning signs and their importance. Administration of medication according to medical order. Problems apply in Ecuador. In our country, the EMSP PNS has arranged for the diagnosis of HIV infection and syphilis in pregnant women in all public sector health units that have a laboratory and some self-employed when knowing the results of the exams. It is considered essential the counseling itself than achieve the professional approach to the patient in order to adequately report the results, providing the support that the situation warrants. Conclusions. Safe sexual practices help prevent the spread of syphilis. Prenatal care is very important. During pregnancy, routine blood tests are done to check for syphilis. This helps identify infected mothers for treatment to reduce risk to the babies and to themselves.
To come back. Syphilis, an old scourge that was nearly wiped out in the United States, is now back, and at alarming rates among newborns in all regions of the country. It's very difficult to see these babies born with significant problems from a disease that was discovered almost 500 years ago, said M. Neil Mason, MD, a pediatric infectious disease specialist at Valley Children's Hospital who treated Chantal and her son. Rising rates. Public health officials blame lack of education, poverty, and drug use linked to prostitution for fueling the epidemic. Between 2012 and 2015, the rate of congenital syphilis rose 46%, from 334 to 487 cases, according to data from the CDC. That's 12.4 cases per 100,000 live births, the highest numbers since 2001. Louisiana, 83.9 per 100,000 live births, California, 28.5, and Maryland, 25, had the highest rates among newborns in 2015. African American and Latino mothers were hardest hit, with 8% and 3.5% higher rates of the disease, respectively, compared with white mothers. These are epic proportions, and we are dealing with this new reality, said Beniyadin Ejai, MD, a maternal fetal medicine specialist at Valley Children's Hospital in Central California. Syphilis is highly contagious. It's caused by a bacteria and is spread through unprotected vaginal, anal, or oral sex. The disease can pass from an infected mother to her unborn child. This spike in cases comes even though syphilis is easily treatable with penicillin, a drug that has been around since the 1940s. A single injectable dose of penicillin, given to the mother immediately after diagnosis and within 30 days of delivery, can in most cases lower the chance of transmission to both mother and child. If a baby is born with the disease, doctors can treat it with a 10-day course of antibiotics or one injected dose. CDC studies reveal that among all 458 mothers of babies with the disease in 2014, 100 had received no prenatal care and 44 had received no information about the disease. When we miss these opportunities to screen and treat pregnant women for STDs, the results, such as babies being born with syphilis, can be devastating, said Sarah Kidd, MD, an epidemiologist in CDC's Division of STD Prevention. The CDC recommends all pregnant women get tested for syphilis, as well as HIV and hepatitis B, during the first prenatal visit. Those who live in areas of high risk, California's Central Valley, for example, should be tested again about 28 weeks in the third trimester. Once treated, women can still be reinfected and need to make sure they continue with testing. The first sign of syphilis is a painless sore on the outside of the genitals, anus, or in the rectum. The sore may also appear on the lips and in the mouth. But many cases have no symptoms, especially in women. People without symptoms may not know they have the disease and pass it on to others. An uncertain future. Chantal, who used only her middle name for privacy reasons, didn't get treated until the final weeks before her son was born, which was too late for him. Antibiotic treatment can halt the disease, but it can't reverse the damage caused before birth. Without treatment, 40% of infected infants will be stillborn or die from the infection soon after birth, according to the CDC. Those who survive can have lifelong paralysis, hearing loss, blindness, profound skeletal deformities, and brain damage. Syphilis had almost disappeared in the United States by 2000. But after the recession of 2008, an estimated 69% of STD prevention programs saw budget cuts, and the number of health clinics dropped by 10%, according to a 2009 survey by the National Coalition of STD Directors. That trend has continued, and sex education programs have also steadily declined nationwide, says Jeffrey D. Klausner, MD, a professor of medicine and public health at UCLA's David Geffen School of Medicine. Because congenital syphilis is one of the most preventable conditions, it's the canary in the coal mine of our public health system, he said. With the current debate in Congress over whether to repeal Obamacare and the threat of leaving millions more Americans uninsured without access to prenatal care, Klausner says syphilis could make a comeback. After infection rates tripled in the New Orleans area, Louisiana authorities issued a health alert in 2016 to all doctors and health workers to increase awareness about the crisis. Some providers said, "Wow, we have never seen a case in 20 years," said Ann Gruber, director of the Infectious Diseases Bureau for the Louisiana Department of Health. With the help of the CDC, Louisiana has established 9 public health regions and active medical task forces. Preliminary numbers for 2016 appear to be going down, said Gruber. We are really hopeful for 2017. Nicholas Van Sickles, MD, an infectious disease specialist with the Tulane University School of Medicine, treats patients with HIV. About 1 in every 5 also tests positive for syphilis. In the Deep South, we have the highest rates of HIV new infections in the nation, and where HIV goes, syphilis goes, he said. When we see these really high rates, our approach should be, we're testing everyone now, even grandmothers in nursing homes, street workers, everyone, said Van Sickles. I even asked my mom to be tested. Maternal substance abuse also adds to the problem, says Brian Barkami-Iyer, MD, a professor of pediatrics specializing in neonatology at the Louisiana State University School of Medicine. In California and Louisiana, public health officials are working aggressively to test for syphilis twice during pregnancy and to make sure infected women notify their partners so they, too, are treated. But often, women lack